It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
I want to thank everyone for being here today. I'm going to, first of all, sing happy birthday to my daughter. That's your cue, baby. Happy birthday to my baby, Siobhan. Happy birthday, Siobhan. I am so happy. I am so thankful that I am your mother.
As a mother, you're such an awesome person all around. Totally awesome. This is the NuWellness Show, TV with Dr. Lee. We are joined today by Lisa K.Y. Wong. She is an author, licensed acupuncturist, and CEO of the Center of Healing by Design. Dr. Lee, as you know, is the host of this amazing show. She is a trained registered nurse from Southwest College in California. She graduated as a physician assistant from Charles Drew University of Medicine and Science in Los Angeles, California. She later became a certified nurse practitioner. She received her PhD in holistic nutrition from a natural health university in Birmingham, Alabama. She is certified in energy medicine and a certified natural health professional. Thank you for joining us today.
Thank you so much. Thank you, and happy birthday again, sweetheart. Thank you.
Thank you,
I have
Dr.
my
Lee.
wonderful guest here, Lisa Wong. I am just so thrilled to have you here today. And our topic is auricular therapy.
Thank you. Thank you.
Auricular
Dr. Lee.
medicine. Being treated without medication. And that's really big, especially for the topics that we're going to be discussing today. All the treatment modalities that can be done without medication, just from using the meridian points of the ear. You can hold that ear up at this point and let people kind of see
I want
it.
to show everybody
Yeah, and
my
it's
big
also
ear.
on the screen there, but we brought a really big ear, which someone here today thought it was a bedpan. That was kind of funny. I guess it could resemble a little bit of a bedpan. But it is a wonderful, nice, big ear. And we have so much material to cover to show how to heal from anxiety and stress and GI problems.
all over.
Any
throughout,
eyesight, spinal problem, back pain. Increase your libido.
That's
This
right.
is going
Even birth.
even birth and healthy
even
through
supporting
childcare.
labor.
And we have a wonderful person who is going to go through the diagnostic component of it, and that's Tony Sweets today. So that's going to be wonderful.
Isn't
And I'm
that
just so grateful
exciting?
that you are here in the studio. And I want to thank you for flying in. I mean, you actually got up early this morning to fly in to be in the studio at UBN. And I honor that.
I am
really
so
do.
excited.
Thank
This
you.
is my very first television show, and being with you, Dr. Lee, my idol, and this is like extreme pressure for me to be here. So.
Oh, no pressure. We see Jarvis over here, who is the engineer, sitting here, and he has so many titles. Sometimes I forget to say them all, but I just love him for the work he's doing to make us look really good. I don't think I would look this good had not for Jarvis. I just want to thank you so much. So I just want to say that we're going to go ahead and get started. So I want you to explain what is exactly auricular medicine.
Yeah, definitely. Auricular medicine, first of all, there are definitely a lot of different schools of thoughts how we actually use the ear to treat any kind of conditions in the body.
Yes.
A lot of people don't know. Be surprised. Most of the world would not know that what the ear can actually treat.
Yes.
In addition to listen.
Yes.
Everybody think that the ear is just for listening, right?
Yes, and they also use the acupuncture with the hands or whole body,
Yes.
and reflexology with the feet. But you can combine all of them together. But you can. The good thing with the auricular therapy, you can diagnose. And
That is the uniqueness about auricular
yes,
medicine.
yes,
When people mention auricular therapy, and this is way back, and it's a long history. And most of the time in the old days, we used the ear as part of the treatment.
yes,
Just like the body acupuncture is for treatment, and the hand and the feet, of course. There are a
Yes.
lot of people love going to the foot spas, right? So foot massage feels great, and also great for treating any kind. All the common conditions is very effective. However, most people don't know that with auricular medicine, Dr. Lee Chun Huang is my teacher.
yes, and
She's
we have her.
world famous. I got a picture of me and her.
Yes,
She gives lecture about auricular medicine all over the world. And she actually, through her work at the military hospital in Beijing.
there she is there on the screen. Yes,
There she is.
and you're going to share something with me, and
Yes.
based on her age, we
Yeah,
could do
exactly.
the massage
I told
for
you
facelift.
she's 70. You cannot believe she's 78, and she got baby face, baby soft skin because she does this. She's her secret. Now I'm giving her secret.
Okay.
She does this ear massage
Ear
every
massage.
morning.
Just
Yeah,
upward, right? Just upward.
Just focus on upward.
Yeah.
Yeah. And this is your beautifying your face, give yourself a little mini facial at the same time as increasing your immune system, strengthening your immune system, just like this.
Wonderful. And then
simple
the
thing.
anti-aging of it too
It's
is.
anti-aging.
But the immune system is so important because
Yeah.
there's lymph nodes right in this
because
area.
there's exactly
You want
lymph
to
nodes,
move them. They don't have their
the
own
front
pump.
and the back.
So this is
Exactly.
helping the lymphatic system.
Yes.
This is really wonderful to know this, to do this exercise. So ladies, start doing this every morning. Not just ladies, men too.
everybody.
Everyone wants to,
Everybody.
improve their immune
Yeah.
system and look young. You look very young. You have this
Thank
cheerful
you.
face,
Thank you.
as I was telling you. So
Yeah.
I'm going to let you go on because
Yeah. So at the end of our show here, if we have time, I'd love to show a very short massage that anybody can do, especially now Valentine's coming up. The couples can take advantage.
Yes. So
and-
we're going to start with your anxiety and depression.
Yes. So
Not to cut you off. I don't want to seem like I'm cutting you off. It's that you sent me some wonderful slides, and I want to make sure we're
Yeah.
able to show each person so we can help
right. So
our listening audience.
right. So regular medicine really can treat all 14 systems in the body, from our nervous system to our endocrine system, which are hormones, to our emotions, to our muscular system, like
Exactly.
our, aches and pains and joints, everything.
Wonderful.
we
So,
could do.
what are those points now? Because as we show it on the screen there, and I know people, or not so much on the screen, I know our listening audience are watching this. What exactly are the points? They could see that themselves, so they can help their anxiety and depression.
Yeah.
If they're going through something right now, they can help self-heal and self-care.
Yes. The very uniqueness about this medicine is it has what I call a whole map of your body is in the ear. I give this very unique name for the ear is souvenir from mom. Why? Because our ear is developed in 22nd day after conception. So everything it is developed in our body after the ear. So the ear is actually a snapshot of your you being the baby inside your mom's womb.
Okay.
So therefore,
And a person has to picture that, seeing a baby, how it's
Yeah. the baby is upside down. If you can see the very first slide that I have is a picture of the baby. Do we see that? Right there, right there, right there. You
there
see?
we go.
There you go. That's so. People just need to be aware of this, that the baby is upside down. So therefore, if we have some emotional problems or having difficulty to sleep and anything with dealing with the head, we will just massage the bottom of our earlobe there.
Right.
That immediately you will feel the blood flow to your head and your anxiety, everything. There's actually there's some points in the back of the ear.
You know, and not to cut you off, but I just need to for a moment, because we said the baby in the ear, and the reason why we're saying that is because of position of seeing the baby in the ear. So those are the points. So if you're looking at the spine, you're looking at where the baby's position. If you're looking at brain, you're looking at baby's position, and then the organs, you can see that because of the position. So it's not the baby in the ear. That is a landmark for actually treatment. Yes.
Exactly. Yeah. The position in the body.
Yes.
It's really neatly laid out. It's like virtually
Wonderful.
like, upside down baby. So that's all you need to understand, and anybody to get a sense of.
Yeah, and that's what I want them to see, that to
Exactly.
see the baby, knowing that if you're going to treat for headaches, where are you going?
Yes.
You're going to
You
the
go
lower part,
directly to
because
the
that's
head
where the
part.
head part.
Exactly.
Exactly. So I just want to make that clear,
Yes.
that people sort of, understand while you're watching the show and doing your self-treatment, because Lisa Wong is going to be showing you the points so that we can do some self-healing.
Absolutely. Yeah.
So I will let you take it.
So let's see if we want. So would you like to look at like different conditions that we can?
Well, we're
treat
going to
in
go
the
with
ear?
your outline you sent. So we're
Yeah.
going to do
So
the
like you can. I just want to just go really quickly over the different
points.
different common conditions that we can actually see in the ear, and we have a special method to diagnose all the different conditions. And
Wonderful.
that's the uniqueness of this medicine. Of course, not everything we can do on our own. Some of these diagnoses we need.
Not a heart attack, and if a person is
Right.
feeling something, at least while they're calling 911, and if you feel some pressure, there's some things that you can kind of do quickly while you're getting help.
Exactly. For example, like one a friend of mine who haven't even really know about everything about the ear, just listening to me talking about how powerful the ear is, and she got this food poisoning one time after Christmas, and she's lay in bed and with stomach ache and diarrhea and everything. And she remember about the ear, and she doesn't know where to rub, but she just rubbed all over the ear.
The entire ear,
And
okay.
In just a couple minutes, her pain subside, and she saved herself a trip
And
to
probably
the ER.
expelled all those toxins from
Yeah.
the body too. Yes.
Basically, yeah. So, but you can, as you know, are we looking at the screen here at some slides?
You're on the stomach and stomach ulcers.
Okay, so for example, that's a stomach ulcer, and that's the stomach part of the ear is inside the cave, the inside there in the middle, and you can, for someone who has stomach ulcer or history of stomach ulcer, they actually have a red dot or some pain or some hardness there, depending on if it's
So if you take your finger and sort of put it inside the ear and sort of feel around, you
feel
feel
around the stomach area, they will feel a little pain. So actually, what it's a great analogy for someone to understand how the ear works is think of the ear as a control panel.
Yes.
And pain, the sensitivity of pain is actually a message. How our body talks to us
Yes.
is through pain. The body doesn't speak English, doesn't speak Chinese, but it speaks pain.
Yes, it does.
So actually, when we feel anywhere in our little ear here, any part of the ear that have pain, then that means that pain actually tells us something.
Okay.
Depending on where the pain is, it will tell us that there might be a problem in that part of the body.
Okay.
In Chinese medicine, there's pain, there's a blockage in the energy flow. So that means our inner doctor, our body, is trying to tell us that we need some attention there.
Yes.
So press me here, dummy. If you think about it that way,
Yeah.
these are all. So if the ear is a control panel, then there means there's these buttons that I call healing buttons will show up as tenderness or pain when there's a problem.
Right.
And then what we can do to help ourselves to start the self-healing is to massage and I teach a class to exactly 3 simple steps what to do with the healing button.
Okay.
To immediately relieve the pain and in effect, when we press those healing button, we're increasing the blood flow to the body, to that part. And
Without needles.
without needles.
Without needles. Yes.
That is the good news, right?
Yes.
Everybody can do this without any
Needles.
special tools or needles. All you need is just your fingers or a pen, if you have a ballpoint pen, without the ballpoint pens.
Yes. Make sure that's clear.
Of
Okay.
course, that's that. But usually just fingers is enough.
Yes.
Yeah. And so it is very effective, very.
Okay, I have a question. If you're
simple way.
using your finger, so many women have very long nails. Have to be very careful with the long nails that you don't puncture yourself. So
That's
is this
true.
a circular motion or is it just pressure placed on that point?
So good question. Whenever you need to find your healing buttons, or when you're just doing preventive treatment, you just massage your ear. Just look for the tender points. So you want to do
And
search for the
take your
whole
time.
ear.
Yeah, take your time going through the entire ear to feel,
Yes.
around the outer part of the ear, which has its own name, but we're going to leave it simple today. The outer part of the ear, just
There-
take your time and feel. Because the back of the ear has a story and the front of the ear has a story.
So yeah, if there's one simple way to think about the ear is the front of the ear is front of the body, back of the ear is the back of the body.
Very
Okay.
good. Okay.
Bottom of the ear is the head. It's upside down, right? So bottom is the head, and the top is the feet.
Okay.
So if we want to massage the whole body, you massage the whole ear,
Yes.
front and back.
Okay.
Okay, and so you want to check to see if your whole body is good and not any problem. Then you would just really go with firm pressure with your fingers, and then going from the inside, and then do what I call this ping the ear massage. Like
Okay.
you use your index finger, you go in, and then you do this little
Kind of a circular motion.
circular motion to
Okay.
drawing small circles, and then go from bottom to up, and make sure you cover every inch of the ear. You're looking for tender points.
Okay.
Yeah, if the tender points will tell you where in your body needs attention.
Where the problem
Yes.
is. And you don't have to know the complete anatomy, your anatomy, to know, say, this is, part of the small intestines, this is
Of
part
course,
of the large
that would
intestines.
need more studying
Then
for us.
but at least if it's tender there, you can start massaging that area because you're dealing with the entire ear.
Exactly.
At least you're going to start to feel better. And then get with a licensed practitioner to help you through this journey.
Exactly.
At least that's going to give you a little temporary until you find out
Yes.
truly what's going on. So you're not going to self-diagnose.
That's right.
You're not going to self-diagnose. You're going to be with a licensed practitioner to help you through this journey. And I say that because you are so good in your field that they
Thank you.
actually had you work at one of the HMO hospitals to provide this service to their patients, because you work with even concussions, people who have had
Yes.
concussions from football players.
Absolutely. Yeah.
Or either young kids playing sports or a car accident.
Yes.
Because you got to open up that energy flow.
Yeah, people with concussions, I have several patients who have brain injuries. Basically, what concussion is, brain injury.
Yes.
And usually it results in these blood clots, because there's internal bleeding in the brain that usually left blood clots pressing on nerves inside the brain and pressing on the cranial nerves, affecting smell and all the different functions, taste, and pain and headaches,
Right.
and even sensations to the feet, numbness and
Yeah,
tingling.
depending on what area of the
Depending
brain.
on where the
area of
blood
the brain.
clot is in
Exactly.
the brain. Yeah.
But you want to know that.
Yes.
You don't want to, with a concussion, you want to get cleared by your neurologist.
Yes.
You want to be cleared medically on every level before doing anything of this nature, because clots can be very serious.
right.
Very, very serious. And
Right.
then, most doctors, we do what is called a continuity of care. So if you speak with the doctor and let the doctor know, or the physician, what it is you're doing, and work in harmony together with the patient, so the patient is not at any risk.
Absolutely.
And that's what I practice, being a practitioner myself.
Yes.
I work with a lot of physicians. I'm not a physician. And I work with a lot of physicians to make sure that patients heal. And we do everything we can. The integrated side, even with my medical training, is a nurse practitioner and other degrees that I have. But still, it's a whole team of people
Yes.
that we work with to get the best quality care to help a person to heal, which is really important. And what you're doing is just amazing. So we have what are your charts on gout? So many people have gout. Now, we can deal with gout, and we're not going to get into the whole nutritional aspect of treating
one
gout.
thing I want to talk about gout is we don't have a very effective way to predict gout and diagnose gout in Western medicine, other than checking the blood tests.
Yes.
In the ear, it's very easy to see and diagnose gout.
Yes.
Why? Because gout is accumulation of uric acid.
Yes, it is.
Due to the kidney having inability to break down this uric acid.
Yes.
So usually these uric acid that gets built up in the body, it gets into the bloodstream, and then they land on cartilage, soft bones in the body. And guess what? The ear is made with soft tissue,
Yes, it is. Very
cartilage.
soft.
So therefore, when a lot of people have lots of uric acid built up, they would end up having these nodules along the edges of the ear, as you can see there.
And you can hold up your big ear here.
Yeah, usually
Big guy.
You see these little bumps, white nodules on the edge of the ear.
We
for
have a
people-
medical terminology for them also, but
Yes.
yes.
So that's, and usually that is the first sign for someone who have gout developing in the
Without blood tests.
Without blood tests, and we could sometimes you could just look at it without even have to do much involve checking.
Mm-hmm.
So this is very good because we can tell our patients to do preventive measures and change their diets.
Most definitely.
If they know that they have gout developing.
Yeah, and if you're on a medication that's why at New Wellness Healthcare, we make sure that on people that are taking medications, to make sure there's not an interaction or a problem with the medication. So
Yes.
that is so important. We're going to cut for commercial,
Okay.
and I want to thank New Wellness Healthcare, which is our sponsor for the TV show, New Wellness TV radio with myself. And New Wellness Healthcare Clinic, we want to put emphasis on today on peripheral neuropathy, because so many people are having problems with peripheral neuropathy. And I'm so sorry that there are a lot of clinics around that I just found out yesterday that are charging anywhere from $4,000 to $11,000 a month to treat for peripheral neuropathy. But at New Wellness Healthcare, you'll be able to go to our YouTube channel and see a testimony of several patients that after one treatment, they didn't feel like they were walking on nails, they weren't in pain at night. Because peripheral neuropathy can be, if you have that problem, you know you have it. It is the most excruciating pain that you can have in your feet, in your joints, mainly in your feet, that keeps you up at night. And so with the treatments that we provide, you don't have this problem. So for anyone suffering from peripheral neuropathy, please give us a call and we'll go through all the steps and let you know about the treatment. And you'll sleep like a baby that night after your therapy. And we're not one of those clinics that charge you thousands of dollars. You know, I have been blessed myself and been through comas and you name it, and I'm still here. And God has me here for a reason, as we all are here for a reason, especially healthcare practitioners. And my desire and my goal is to see you heal, healthy, whole, and well. That's number one. So we have a wonderful program at New Wellness Healthcare for peripheral neuropathy. Call us at 310-419-4300 for additional information. I want to thank our sponsor, New Wellness Healthcare, for this wonderful show today. So I'm back to my guests. I want to always say Dr. Lisa Wong, acupuncturist. You have been in this business for how many years now?
Well, it's since 2010 that I met Dr. Li Chun Huang and really fell in love with this medicine. But I think when it comes to the ear, I think when I realized that it was since childhood, as young as 3-year-old, that I fell in love with the ear, and I didn't make the connection until recently. That wow, it was my dad told me a bedtime story about this monkey riding on the elephant and pulling on the elephant's ear to drive the elephant.
Okay.
And that is like, it really, I guess, subconsciously planted a seed in me that I'm fascinated naturally with ears. And now today, I've been pulling on people's ears and using the ear as a guidance to help me help people. And also my passion in life is to open people's eyes to how miraculous, how powerful our ear is, that the body is so intelligent that put out all the information on the ear for us to discover.
Oh, wonderful. You know, and so can we bring in our person who's going to let you demonstrate on his ear?
Absolutely.
Yeah, so we're going to bring in Tony Sweets.
Okay.
Thank you, Tony, for letting us borrow your ear. So thank you.
Thank you.
And you're going to be able to actually diagnose. She knows nothing about you. She's not going to tell anything about your medical history. Not over the air. But she's going to be able to pinpoint the area of concern.
Okay.
Yes. I would need my tool. Let me, let's see.
It's gonna be good.
Yes, it's going to be great. You didn't know that was my surprise for you today.
No, I didn't.
Yeah.
This is all right.
And then we have one for Jarvis,
Uh-oh.
too.
Those big old ears.
Oh, we can see it good. See those points.
How did they do?
Yeah, you have a nice size ear.
Do I? All right.
Yeah, nice size
They're
ear.
gonna get big and like when I
Yeah,
get
so
old?
don't rub on it because there's
don't
certain
rub,
things
okay.
she's going to do.
I
And
won't
actually,
touch
it changed in color based on what's going on, too.
Oh, okay.
Yeah.
All right.
So we'll let the person who, this is what she does.
Yes, this is my specialty.
And, you know, it's so wonderful that she decided to come here. This is her very first time being in a studio.
Wow.
Yeah.
You're
Yeah.
doing a great job.
So
Exciting for
we've been
me.
talking every day.
I know, right?
She's been so excited.
Right,
Yeah.
Does it matter which
Let's see.
ear?
Do we have a camera that could
Right here.
zoom in? Okay.
Why am I upside down? Oh.
Well, actually, we will look at both
Both?
sides.
Okay.
'Cause even though, yes, we only have one prostate, but there's two sides of it,
Oh,
right?
okay, right, okay.
So the prostate could be enlarged, or it could be in regular size, or it could be, you know, have all the different kinds of conditions.
I didn't know that prostate and ears go together.
Yeah.
Wow. Here, that's why we're telling people that the ear actually is connected to every part of our body. So there's a button for every part of our body in our ear. So our ear is like a fuse box.
Okay. Well, so what do you need me to do?
Okay. So let's see. First of all, I want to. So the part of the. Let me show it in those big ear then, for just to pinpoint where the prostate point is in the
Okay.
ear. Okay. So the prostate is in the lower part of the body, so it would be the upper part of the ear because the ear is the upside down version of your mini body.
This ain't no mini body.
Mini buddy. That
The
sounds
mini
cute.
me. And so the prostate point is actually over here. So I'm going to look at this part of your ear, so it's sort of in the inside, to
Okay.
see if there's any
Uh-oh.
change.
She's
or-
not going to tell anything. Whatever
Well, I
she
would-
finds, we're not going to
Oh, I
tell
don't
it to the
care. Unless
world.
it's like I have a day to live or something.
Or and you want as how many people are watching the show?
Oh, we
won't
have,
be any privacy.
my life insurance company.
So I'm gonna take a look at the
Okay.
inside here because the prostate point is in here. So I'm looking at the shape first of all. It looks very normal. So your prostate is not enlarged or anything.
That's good.
So you didn't have any issues with urination, right? When you
no many times getting up to the bathroom. And see,
Not yet,
I want to
anyway.
I want to say that for the many men who are listening to the show or wives or girlfriends, you know, you can keep kind of
yeah.
looking. But
Okay.
I just want to say that those are some things that you can test out yourself for your partners
Tell me
just
if
to
it's
see if that's tender in that area
any pain
or
tenderness.
if it's red.
It's a little tender?
So there are some symptoms that'll show up in the ear, not like there's a lesion there or something, they're not really pronounced, that will kind of show.
here?
But then you can also go back. Now, this is a diagnostic part of auricular therapy. Then you can go back actually and treat those areas. So guess what? Today at our clinic at NuWellness Healthcare, I want to say doctor all the time, Lisa Wong, we have several people who are coming in for
here?
treatment and diagnostic. So if you want to be in today while she's in town, please call me at 310
tender?
419-4300. While
So,
she's in town, we're going to be doing
There might
some of
be
this
some,
in person. So you'll have a chance to meet and work with her up close. And this is something you can take home to do forever. And each one teach one as far as helping the families. Okay?
The prostate.
Really? Okay. I used to have. a large prostate.
Used to have.
Yeah,
So that's
like
just
10 years ago.
okay. Not this
Not
side.
So you can give your
Let
little
me check
testimony
this-
if you don't
Let me
mind.
just
Oh,
test
She
yeah.
just
this
found
out.
out a little something there.
All right,
Okay.
Yeah, okay, and let me check that.
All right.
Oh, the light
Now the
changed.
instruments that
wait a
she's
minute.
using
Okay.
is not something we advise for you to do at home. At home, you're going to be using your finger. She is a licensed acupuncturist, so she can do this. Auricular
Any pain here?
medicine.
Right there. No, just
A
tender.
little bit tender here?
Just tender.
Okay, so slight tag, huh?
Mm-hmm.
So, how about here?
So as she's doing this, she's going around
Right.
the areas around the prostate so
There,
that
a
you
little bit.
can
Right here?
find
just
out
a little
if
bit.
there is enlargement, tenderness.
So what I did check is,
And, you know, after doing this, as
checking
being a
your
practitioner
reproductive
myself,
system,
I would probably
From
do
the
a
testes to,
prostate ultrasound
to the kidneys
and test out
to
some
the
other lab
prostate.
testing just to see what's going on,
So-
along with maybe a PSA. And there's pros
So
and
pretty
cons
much
on
we don't
PSA testing.
find much
But
problem.
I like to rule out
Just a
everything
little
and do all the tests and make sure
tag.
we cover everything at New Wellness Healthcare.
Okay?
All right.
And a little bit in the kidneys. Do you have low back pain?
I didn't tell her anything, Tony. I didn't tell her anything.
So the kidneys is really your the core reproductive system, the CEO of the body of
Right.
the energy, right? The core energy. So if it's weak, oh sorry, okay,
There you go.
yeah. So your kidney energy is a little weak, then you should have sore low back, right?
Yeah,
Right,
it's
tend
been
to
really
have
sore
that.
lately. So
Yes, yes. So it's due to some inflammation in the reproductive system. So from the testes to the prostate. But I don't see any enlargement in the
yeah,
prostate.
no, I haven't had much problem with urination.
And you know
so-
something,
Right.
Lisa?
Mhm.
You didn't know anything about Tony, and not to reveal, but the one thing I told you I was bringing you was for the colon. Remember? Yeah, I said it's something I intuitively I knew we had to hit the colon. That was also going to hit the inflammation, and what I was bringing you is for leaky gut. So when you hit the leaky gut syndrome, you're going to help heal a lot of what she's finding today.
Oh, wow.
So I'm glad I didn't do that because I mean I want you to be well,
Right.
But
I wanted to
at
wait.
least we were able to find these things out.
It would be it would be nice if Tony can come to the clinic later and we can do a whole body exam
Oh.
for you, because I can read the whole ear, the whole body, and we'll be able to put the pieces together. You know, because not just we don't just look at one
Right.
Area.
Right.
We're
The
holistic
whole body,
medicines.
right.
We
There's a
look
lot of points
always-
on there.
The
so.
whole body.
We look at the whole body and then make connections, because they, you know, one part of the body have problem, usually means the other parts of the body
Most
also
definitely.
have
Something's-
problems. Yes, we need to find out the cause and effect.
Wow. Okay. That's
So-
great. Wow.
Yeah.
Yeah, we
Who would
can.
have thought?
How
You know,
about-
and the thing
yeah.
is, you know, a lot of people have been suffering from a lot of things
Yes.
for years and not
Yes.
knowing exactly what the cause, and you can't keep covering up stuff with antibiotics. Now, with this type of treatment, what you can do is you can also treat with the ear. Oh, so all those points you can treat. So you don't
That's
have to. You diagnose and
Yeah.
treat.
This
That
is-
was my
the
gift to
ear
you
is
today.
like a color MRI, and actually because everything that happens to our body will always have a mark in our ear. Our ear is like a living medical record.
Oh, wow.
So when I see patients, I don't ask you anything about you. I ask your ear by reading your ear, and then the ear tells me
That's great.
what's going on before, in the past, or right now, or sometimes in the future, because we have also, if you have any genetic issues or anything developing, the ear also have indications.
I know. Wow.
Is-
My mother and her side of the family.
Wow.
Always.
So
have
again, people
something.
who want to
My
check
dad's
this
side's
out,
not so
Yeah.
bad.
please call us today while she's in town.
Yeah.
Mhm.
That's awesome.
Yeah.
Yeah.
Thank you.
You're welcome.
Appreciate it.
So yeah. So no, your gift is after.
Oh, okay.
Yeah. So because we'll discuss that later because we're on air.
All right. Well, then, thank you so much. I'll talk to you after the show.
Absolutely.
Yeah.
I'll
It's
let
a
you get back to the
pleasure.
show.
And I thank you so
Thank
much,
you.
Tony,
Thank you.
for
The guinea pig.
yes. At least you have a clearer understanding too.
No, I wouldn't have
Yeah,
known. I
yeah.
wouldn't have known that.
Mhm.
So that's great. There you go. Now you can
Thank you.
free talk.
Thank you. Thank you.
All right. Thank you.
Thank you so much for volunteering.
Yeah.
Thank you, Jarvis, for keeping those cameras going. I see you over there really, really busy. Thank you so much, Jarvis.
Great.
He is top in the world, top in the field.
Wow. We're so lucky.
I hate to put it out there because somebody might steal you away from me. But he's wonderful.
Yeah. You see, the ear, you can see every systems, every
Yeah.
part, and from the most visible parts to the most invisible parts, the
Yes.
most private parts, and that's the beauty of this medicine is we are able to treat those private parts very easily
Yes.
without a lot of awkwardness.
Mm-hmm.
And, we don't need to disrobe or anything, and still be able to treat those sometimes those very embarrassing conditions like hemorrhoids and
Exactly.
for a lot. I see a lot of women after delivery,
After
and
childbirth,
after
yes.
childbirth, they have hemorrhoids for many years,
Mm-hmm.
and they suffer through it, and they are still embarrassed to tell
Most
people
definitely. And what
it.
about the prolapsed uterus?
Yeah,
Because the ear has every structure,
exactly.
every cartilage, every bone, every nerve. And I like how you had mentioned, a while back in our conversation prior to the show, the control panel. So the control
You like
panel,
that
I
analogy.
love the control panel because that's like your brain. The brain is your control panel. So we have to make sure that we cover everything.
Yes, and we in the reality is we actually have multiple control panels.
Yes.
Not just the ear, but the ear is foremost the most powerful and effective control panel there is.
Exactly.
Even though it's the smallest one. But it gives us so much information
Yes.
that we can help ourselves heal and activate ourselves.
And before we run out of time, I want us to kind of go over the ovarian, because there's so many problems with people with ovarian fibroid tumors, ovarian cysts, and kind of hit a little on that in thyroid, because we don't have a lot of time left.
Okay.
But we want, because
Yes.
so many women suffering from ovarian problems and fibroid tumors.
So ovarian, any kind of women issues, whether it's in the uterus or the ovary, or the breast, it's from what I see in my patients, it's a lot of these problems come from our diet. Eating meat that are laden with growth hormones.
Oh,
and
yes. That's
antibiotics.
always number one.
Yes, and a lot of growths with fibrosis in the ovary, in the breast, in the uterus, in the cervix. Usually, when I see those, and it's very easy to check in the ear.
Yeah.
Those
So I kind of want to
spots.
show where that is, so
there's
it can help them
slides
to
that-
find out too.
Yes. One thing is very easy to find out the ovarian cyst. It's just by looking at the ear, this part of it. What I don't need even to check with my pen here, and most of the time it's 100% accurate that women have ovarian cysts. You can see it in the ear.
Okay.
And then we can advise them to change their diet. In those cases, then usually the cyst will shrink. So is same thing with fibroids, and any kind of also inflammation in
and that's
those
more of the circular
areas.
massaging as we go back. We are just about out of time.
Okay.
So what I want to do is you had something you wanted to share with our guests.
Yeah. Um,
Especially we want to, since we're up to the holiday, what they call,
absolutely.
what people need to know really what that really mean, but how to really satisfy and help increase your libido with your partner. So we want to,
That's-
it has to be really brief because we're really almost out of time.
Okay.
We
So
have
we
it on the
make it-
screen there. Well,
Okay.
you said they can order this
Yeah.
free?
So I'm developing this series of videos where I teach couples, not just love romantic couples,
Yes.
but parental and child and
Yes.
friends
Just
to
being
learn
healthy.
very simple massages to help themselves, help each other to
Exactly.
be healthy, and also build their relationship.
Mm-hmm.
So that's something I'm going to have available soon. But for today, I want to offer our audience a free gift
Okay.
because it's Valentine coming up. So I have a video teaching people, lovers in this case,
Okay.
couple, how to spice up their relationship,
Okay.
balance their hormones, and boost their immune system.
Okay. So
And
everyone go
at
to
the
that
same-
website.
At the same time,
Yes.
yes.
It might have been a
pointing
little
out
too
the-
graphic for us on today.
I was hoping we have a demo patient here. So,
Well,
but the video also
yes,
tells
we'll go,
everything.
Yes.
Yes, and that definitely. Then you really want to go and grab your free gift. Along with that, I also give you this chart, your map, to see where that libido point is.
Okay.
So you can really
The libido part in your ear.
the libido in the
Ear,
ear.
yes.
the button that I call it the good hot button you want to
Okay.
press.
So you want to go and watch this video to find the good hot button.
The good hot button.
Okay.
Not the hot button get your partner angry, but this one will get
I'm happy
happy and
and relaxed. And
exactly, and get you guys into the mood.
yes. Okay. I want to say that Lisa Wong, you are phenomenal. And I thank you so much for taking this wonderful long trip.
Thank
and
you,
flying
Dr. Lee.
in.
Thank you, Dr.
We've
Lee.
had a long morning this morning, but it's been wonderful and well worth it. And I just honor you for taking the time to fly in, to be here on the NuWellness TV radio with Dr. Lee, along with being here at UBN Studios. Just a beautiful studio. I love it here.
It is,
Yeah.
isn't it?
Yes,
And
it is. And
I'm just
thank
so
you,
grateful
Jarvis. Thank you
for
so
this
much for
opportunity to be here
Our
with
engineer
you, Dr.
over
Lee.
here, he's just phenomenal. Just totally phenomenal. Look at that smile on his face. Like he's shy or something, you know? I am just so thrilled and so happy to have such great people. And today I really want to thank my social media people that really, they're working really hard to keep everything going. And I just want to this time publicly thank you for what you're doing and really trying to pull things together. And they're young people. So again, thank you very much, my wonderful social media. So thank you. And again, happy birthday, Siobhan. You know, this is your day. Thank you. I know you're listening.
And happy Valentine to
And happy Valentine's Day.
everybody.
So again, as I close the show, I don't have on my pen today. I can't believe I left it at home. Repeat after me. I am
I am
so grateful
so grateful
that I am
that I am
a magnet
a magnet.
for miracles. Take that into yourself this week. We've had some wonderful people share their stories also. I want to thank everyone. Please tune in next Wednesday from 11 to 12 Pacific Standard Time for the Cherilyn Lee, the NuWellness TV with Cherilyn Lee. Thank you so much. Thank you. Thank you.
Thank you so much, Dr. Lee.
Thank you again. I really
Join us
appreciate you.
every
Thank you.
Wednesday
Thank you.
live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.